Hi everyone, it's Valeria again. As mentioned, I'm a third year medical student at the Jacobs School of Medicine in Buffalo. And this week, we're actually going to go over some common anatomical features within ENT. And you'll see a lot, as we mentioned in the meeting today, that there are certain words that are used for an inside of a body versus the outside of it. For instance, we have the outer ear, which is mostly said as oreja. Again, oreja is just the ear, usually referred to the pinna and just as in general the outer sense. And then we have oído, which can be used as ear in general, but it mostly refers to the inner ear. We also have garganta, which is the throat. Garganta. This is occasionally confused with cuello, which is neck. So we want to make sure not to do that. Again, a throat is garganta and neck is cuello. So we really don't want to confuse those because obviously if someone has, I have neck pain, it will be different than I have a sore throat. Same thing in Spanish. Then we have lengua, which is tongue, lengua. Vocal cords are cuerdas vocales. Vocal cords are cuerdas vocales. La uvula or uvula, it sounds the same thing. I've heard in clinics, sometimes people call it a campanilla, just as an informal way of referring to this, but it's the same way you would say it in English. Um, Vía respiratoria superior, it's a long one, or vía respiratoria is the upper airway. Vía respiratoria superior. We have the nose, which is la nariz. The Spanish, sometimes say nariz, but I'm not Spanish, I'm from Latin America, so I say nariz is the preferred way. We also have orificio nasal or fosa nasal, which is a way to refer to nostril, and it's not really used in colloquial conversation or casual conversation. It's mostly obviously used in the clinical form, but as future ENTs, we're going to use it more often. We also have el tabique, which is a nasal septum. So, for instance, if we would want to say a deviated septum, we say el tabique desviado, but tabique is a nasal septum. We also have senos paranasales, which is your paranasal sinuses. And over here, you also have the different sinuses, like seno maxillar, like the maxillary sinus. I just recommend not to say senos alone because senos also refers to breasts. It is a proper term. You can use it in a medical setting. It's not a derogatory term, but just so you know, that can be a sign of confusion. Amygdala is tonsil. Amygdala is tonsil. So it's the same way that you will look like the cerebral amygdala, cerebral. You would say the same in Spanish, but remember that amygdala alone is tonsil. I have seen some Spanish interpreters say tonsila, but this is actually an Englishism and it's not the proper word. So as now future ENTs, you know exactly that it's amygdala. And adenoides is adenoids, adenoides, adenoids. Thank you. That's all for this week, and I'll see you next week.